Our bodies are complex ecosystems home to trillions of microorganisms. These tiny entities, invisible to the naked eye, play a significant role in our overall health and well-being. They inhabit every part of our body, from our skin to our gut, forming a delicate balance that is crucial for our survival. Most of these microorganisms are harmless, even beneficial. They help us digest food, protect against harmful bacteria, and maintain our immune system. For instance, probiotics in our gut aid in digestion and nutrient absorption, while beneficial bacteria on our skin act as a barrier against infections. However, some microorganisms can cause infections, leading to discomfort and health problems. When the balance of these microorganisms is disrupted, it can result in various infections. These infections can range from mild irritations to severe health issues, affecting our quality of life. Among these are sexually transmitted infections, or STIs, and fungal infections. STIs are infections that are primarily spread through sexual contact, while fungal infections can occur on various parts of the body, including the skin, nails, and mucous membranes. Understanding these infections is crucial for protecting ourselves and our partners. By being aware of the causes, symptoms, and treatments of STIs and fungal infections, we can take proactive steps to prevent them and seek timely medical intervention when needed. In this exploration, we'll delve into the world of STIs and fungi, shedding light on their causes, symptoms, treatment, and most importantly, prevention. We'll look at how these infections spread, the common signs to watch out for, and the best practices for maintaining good sexual and overall health. Knowledge is power, and when it comes to our health, it's even more critical. Educating ourselves about STIs and fungal infections empowers us to make informed decisions, reduce stigma, and promote healthier lifestyles. By understanding STIs and fungi, we can make informed decisions about our sexual health and overall well-being. This knowledge not only helps us protect ourselves but also enables us to support and educate others in our community. Let's embark on this journey of discovery together. Through awareness and education, we can create a healthier future for ourselves and those around us. STIs, as the name suggests, are infections passed from one person to another through sexual contact. This contact can include vaginal, anal, or oral sex. It's important to understand that STIs are more common than many people realize. They don't discriminate based on age, gender, or sexual orientation. Some STIs are caused by bacteria, while others are caused by viruses or parasites. Common bacterial STIs include chlamydia, gonorrhea, and syphilis. Viral STIs include herpes, HIV or human immunodeficiency virus, and HPV, which is human papillomavirus. Trichomoniasis is an example of an STI caused by a parasite. STIs can manifest in various ways, and sometimes there may be no noticeable symptoms at all. This makes it incredibly important to get regular screenings, especially if you are sexually active with multiple partners or have had unprotected sex. However, it's crucial to be aware of potential signs, which can include unusual discharge from the vagina, penis, or anus. This discharge can vary in color, consistency, and odor, and noticing these changes early can be a key indicator that something is wrong. Pain or burning during urination is another common symptom. This discomfort can range from mild to severe and can be a sign of an infection that needs immediate attention. Sores, bumps, or rashes in the genital area are also warning signs. These can be painful or painless, and they might appear as blisters, warts, or other unusual skin changes. Pain during sex can also be a symptom, making it uncomfortable or even unbearable to engage in sexual activity. Swollen lymph nodes in the groin area can indicate that your body is fighting off an infection. These nodes may feel tender or hard and can be a sign that you need to seek medical advice. If you experience any of these symptoms, it's essential to see a healthcare professional for testing and treatment. Early diagnosis can prevent the infection from spreading and causing more severe health issues. Early detection and treatment are vital in managing STIs and preventing long-term health complications. Regular checkups and open communication with your healthcare provider can make a significant difference in your overall health and well-being. Treatment options vary depending on the type of infection, but often involve antibiotics for bacterial infections. These medications can effectively clear up the infection if taken as prescribed. For viral infections, antiviral medications are commonly prescribed. These can help manage symptoms and reduce the risk of transmission to others. Always follow your healthcare provider's instructions and complete the full course of treatment to ensure the best outcome. Prevention is always better than cure, and this holds especially true for STIs. Sexually transmitted infections can have serious health consequences if left untreated, including chronic pain, infertility, and even an increased risk of certain cancers. Therefore, taking proactive steps to prevent these infections is crucial for maintaining your overall health and well-being. The most effective way to prevent STIs is to abstain from sexual activity. However, we understand that this may not be a practical or desirable option for everyone. For those who choose to be sexually active, it's important to be informed and take necessary precautions to protect yourself and your partners. However, for those who are sexually active, there are several measures that can significantly reduce the risk of infection. Educating yourself about STIs and understanding how they are transmitted is the first step. Knowledge empowers you to make safer choices and to recognize the importance of regular health checkups. Practice safe sex by consistently using condoms. Condoms are highly effective in reducing the transmission of most STIs when used correctly and consistently. They act as a barrier that prevents the exchange of bodily fluids, which is a common way STIs are spread. Always check the expiration date and ensure the condom is intact before use. Get tested regularly for STIs, especially if you have multiple partners. Regular testing helps in early detection and treatment, which can prevent complications and reduce the spread of infections. Many STIs can be asymptomatic, meaning you might not show any signs or symptoms, but can still transmit the infection to others. Openly communicate with your partner or partners about your sexual health, and encourage them to get tested as well. Honest conversations about sexual history, testing, and protection can build trust and ensure that both parties are taking steps to stay healthy. It's a shared responsibility that benefits everyone involved. Consider vaccination for STIs like HPV, which can prevent certain types of cancer. Vaccines are a powerful tool in the fight against STIs and can provide long-lasting protection. The HPV vaccine, for example, is highly effective in preventing infections that can lead to cervical and other types of cancer. Remember, taking responsibility for your sexual health is not only about protecting yourself, but also about protecting your partners. By being proactive and informed, you contribute to a healthier community. Your actions can help reduce the stigma associated with STIs and encourage others to take their sexual health seriously. It's a collective effort that starts with individual responsibility. Section 5. Entering the realm of fungi, a different kind of infection. Now let's shift our focus to another type of microorganism that can cause infections, fungi. Unlike bacteria, fungi are eukaryotic organisms, meaning their cells have a nucleus. Fungi are everywhere in our environment, in the soil, air, and even on our skin. Most fungi are harmless and some are even beneficial, like the yeast used in baking. However, certain types of fungi can cause infections in humans. These infections can affect various parts of the body, including the skin, nails, mouth, and genitals. Fungal infections are quite common and can affect people of all ages. One of the most well-known fungal infections is athlete's foot, a condition that causes itchy, scaly skin between the toes. Another common fungal infection is yeast infection, which can affect the vagina, mouth, or skin folds. Ringworm is another type of fungal infection that can appear as a ring-shaped rash on the skin. Fungal nail infections can cause the nails to become discolored, thickened, and brittle. It's important to remember that while these infections can be bothersome, they are usually not serious and can be easily treated. Treatment for fungal infections typically involves antifungal medications, which can be in the form of creams, ointments, pills, or even intravenous medications for more severe infections. The type of medication and duration of treatment depend on the location and severity of the infection. Preventing fungal infections involves keeping the affected areas clean and dry. Avoid sharing personal items like towels, combs, and shoes. Wearing breathable clothing and footwear, especially in hot and humid weather, can also help prevent fungal growth. Whether it's an STI or a fungal infection, early detection and treatment are crucial. Ignoring symptoms or delaying treatment can lead to complications and long-term health problems. Regular checkups with your healthcare provider are essential for maintaining good sexual health and overall well-being. Don't hesitate to discuss any concerns or symptoms you may have, no matter how embarrassing they may seem. Remember, your health is your priority. In conclusion, understanding STIs and fungi empowers us to take control of our health. By being aware of the causes, symptoms, treatment options, and prevention strategies, we can make informed decisions about our sexual health and overall well-being. Remember, knowledge is power, and when it comes to our health, it's the most valuable asset we possess. Let's continue to educate ourselves and each other, breaking down stigmas and promoting a culture of openness and responsibility when it comes to our health.